Hello everyone and welcome back to my channel Physiotrendz. This is me, Physio and today's session we are going to talk about pain. And to talk about pain, we have with us Dr. Prashanth Mukkannavar, who is a principal at KLE Hubli. So sir is expert in pain and we are going to get all the information about pain and what we don't understand about pain being a physiotherapist, that everything we are going to talk about. All right. So welcome, sir, to Physiotrendz, and thank you so much for agreeing to have this video with us.
Thank you so much for
Yes.
inviting me, and let's see what
Yes.
material would come up.
And sir, it's a pleasure. We met here at Jain University, this good conference.
Yes.
And I am very lucky that I got time to talk to you about this physiotherapy, discuss about physiotherapy as well as pain. So, sir, as you are expert about pain, I want to know what is really pain and what, as a physiotherapist, we are not understanding about pain.
Yes. I'm still learning about the pen as such. Still, also so many years of experience, but still, it's like a quite dynamic. Coming back to the understanding of pain, as a personal view, I wanted to tell you, not like professional way. Even I struggled a lot in treating patients, especially in MSK part of it. So pain is all about emotional component we've forgotten to assess those areas.
Okay.
And we always believed in the pain as a tissue damage, and because of tissue damage, we are supposed to treat that, fix the tissue kind of thing. Correct.
Right, yes.
So we forgotten the part of assessing the part of anxiety, emotion, all those areas of which is affecting the biopsychosocial, we call it as social component. We never understand till date also, and we not pitching in those areas. So when we are going for this kind of assessment during my clinical part of treating patients, I understood that okay, something is missing over there. Although I did my PhD and everything, but still also I was not happy.
Okay.
Okay, so somewhere I felt I lack something which I'm unable to understand. So that motivated me to understand okay, what exactly is all about.
Okay.
So to tell all the audience, pain is always a context. Pain is a personal experience for the patient.
Right.
Correct? Yes. So we have to validate what patient tells. It is not what we pursue. What we do usually in the clinical part of it, we have our mindset as a therapist. Patient aaya, okay, treat as per the assessment, test it, prescribe the treatment, and send it off. No, it's not like that. First, what patient wants, we should able to understand, right?
Yes.
That's what we're supposed to explore ourselves in assessment part.
Yes.
That's what I'm thinking about it.
So normally, sir, according to you, when we are taking assessment, so we learn about like SOAP format, you have to follow everything. But technically, when it comes to clinical practice, we don't have that much of time.
Yes.
So what will you advise that we should focus more on and we can have a accurate assessment, like proper assessment? What should we do more to understand the pain?
I think basically, if you go back, whenever client comes or patient comes, first listen without judge him. Validate his experiences first. Have open questions to the patient. Don't just keep on judging everything, okay, because of this, and you tend to give that judgment that okay, आपने ये किया था, वो किया था, and you got the pain and all. It's not like that. First, listen, understand well, and if you have any doubts are there, don't interrupt during his session of interviewing process. We never call it an assessment. We call it as an interview process, like what we are doing right now.
Right.
To know a person, we require understanding of ability to listen first.
Yes.
If you don't listen correctly, if you interrupt every now and then, patient will he never gives a clear picture of ideas. And it's not possible to have first session of understanding a patient, not possible. Subsequent follow-up only you understand patient much better way.
Yes.
What he likes, what he love to do it. Depends on that only you can able to understand what his pain is all about, what affects his life, psychosocial, biological. In all regard, we need to access those things unless until we do good interview process.
So to learn all these things, what can we advise? Like physios should go and read what, or what should they do?
Basic thing I'm telling you, I'm not telling you very out of the box and out of syllabus, something like not like that. It is just listen, validate patient experience, and understand what you read and whether it is really you can able to make that sense with the patient. Sometimes we heavily rely on the orthopedic assessment part of it.
Right.
Although if you go back and find out the literature, it's quite a poor validation exists there. But we never explore patient belief system, patient expectation, correct?
Yes.
We always throw our own belief of the modality and throw that thing and get the results done.
Yes.
But we never tune with ourselves with the patient experiences and all. Correct?
Right.
So patient requires what he wants. which context patient want to run. Suppose patient having knee arthritis, he can't able to pick his or her grandchildren, correct? So, but we tend to do all those open kind of exercise we treat them, but they tend to have a kind of bending activities kind of thing required under closed chain. We never focus, we never ask them what they would like to do it. I'm giving example of these kind of example.
Right.
Probably they may understand that.
Yes, so it's like we can say purely subjective thing. We have to go according to the patient's needs and requirement. So listening to patient is most important. So sir, as you mentioned just now about the orthopedic assessment, I have few doubts. Like in orthopedic assessment, especially about the pain assessment, what we do is we take VAS or NPRS, then we take type of pain, intensity of pain, and after that maybe if possible we'll do the tenderness, grades of tenderness, and the pain assessment is over. So here, what exactly we are like as you mentioned, we can add the emotional component. We have to listen to the patient, everything. So do we have any format for this also?
Yes. Nowadays we are exploring, and how many people really come across during the part of the type of pain we talk about, isn't it? We call it as like a nociceptive pain, nociplastic pain, and we call it a neuropathic pain. These are three classifications given by IASP body, International Association of Pain Science. No, those people have given the entire picture of definitions. Operating terms are given, but we only know acute pain and chronic pain. Correct? Okay.
Yes.
Coming back to assessment part of it, how many people are really confident about understanding whether what patient believes? For example, he may be having a phobia. We call it as kinesiophobia, fear of movement.
Yes.
Have we explored that fear of movement in our assessment? So far, contemporary, what we do, we never do. So there are a lot of questionnaires that exist. Okay, there's something called as pain catastrophizing thing. They just assume they get pain.
Yes.
For example, I'm giving the same example of knee arthritis. Patient, imagine that, okay, I can't able to climb one step also. If you ask further, they tell that, no, I get fear. I get more pain. If I put the leg, I get pain. So this is what exactly components of psychology part of coming picture.
Yes.
Sometimes what happens, social things are there, social factors which are modifiable, we call it non-modifiable factors, we call it as. For example, if they are attending marriage, they love to attend marriage. The moment they come out from the marriage and come back to the house, they get pain. That time they forgotten their whole thing. But they never think about how they perform during the marriage act and everything, whatever function they're attending and all. So this is what exactly happening around social factors, how they influence patient mindset.
Yes.
We need to explore what they like, what they don't like, which things are comfortable. We don't know all those things.
So sir, can we, like, this is again my doubt, that can we connect this, what you're saying, to a psychological issue, or it's still pain only?
Yes, it's a multifactorial. Pain is not a single cause. You cannot explore single cause. I'm so sorry for the audience to tell that. Okay, really.
No, that's
It's multifactorial. You have to accept the fact. Multiple things and influence. The environment, the context, the experience, expectation, all those things are influencing patient world. As a physio, I'm spending 45 minutes of 1 hour time, isn't it? Why can't you take advantage of understanding what he believes? Patient comes to your clinic, but we never ask how much knowledge of physiotherapy they have. They have been exposed to this kind of treatment. Somebody has visited so many consultants. Have they given any kind of feedback? Example I get, example like patient tells that doctor ne mana kiya ki not to sit down, to wear belt, they tell.
Yes.
Isn't it?
Yes.
But did we inquire this kind of a belief system? Why? What they believe? What do you think? How you gone into this? Applying those things. We never ask these questions.
Yeah, we just directly jump into the treatment part. We just want to cure the pain and then just send off the patient. Right, but we never think about like what exactly is happening.
But how to change the behavior? Ultimately, behavior change is important. No.
Yes.
We should always remember as a physio, it is like not therapist-oriented treatment. It should be a patient-centered approach. What patient wants is supposed to be treatment, not like what I want as a therapist. I should give treatment. I'm so sorry for that to tell that.
And also, sir, there is one mindset also. Like today, for example, I'm reading about some treatment, or I read some paper about some, like, okay, this is effective for this condition. Tomorrow onwards, if I'm seeing that patient, I will start treating the patient with the same treatment only. Exactly. I will not even think about something else.
That's what we need to explore our own belief, challenge our own belief. I always tell, whatever we have read or you are reading, challenge that first. Or ask expertise who are there already existed in our areas and all. Probably we have to have an open mind always. How things work, we never understand this. We always take it like a hardcore belief. I bought this machine, I have to apply this, I get the good results. one experience doesn't make any accountable for the evidence. I'm so sorry.
Yes. No, very true. So, sir, according to you, like which are the best 5 papers or 5 blogs or something you will advise audience to read to understand pain better?
I say blogs, matlab you can have so many people are there. So many people really make an effort. I remember I have read many literature from the Bronnie Lennox Thompson. She is an occupational therapist from New Zealand. Her blog is Health Skills is there. Fabulous. Okay, they can explore that. Noi Group, they are making very fantastic kind of a blogs, and they have got special kind of books they have released. So many pain education material has been designed so far, and we are also working towards pain education in Indian scenario. Especially imagine karo India में almost 27 languages are there, and we have to have a creative pain education materials in all 27 languages. Our language changes every 2 kilometers, isn't it?
Yes.
So like that. So dialect changes. So we have to design material. People need to understand this kind of reading habits, and educating from the therapist perspective also required. I'll give one more suggestion part. There is something called as pain motion. It's like I think it's a different country this, but they have converted into English language. Fantastic material available there. They can read those areas. In fact, Joe Spitty has come up with a many kind of editorial column on pain science itself. They can read those articles fantastically. And I suggest few personalities we're supposed to follow those people who really think critically in depth of it.
Right.
Like I think Gregory Lehman is there, and there is one more person. If you really want to follow this, David Butler is there. Yes, and one more person. What's her name? Natasha Statner. She is a faculty from Southwestern University. So okay, she's good in research kind of thing. They are the pioneers who are really working. And one more, Joey Noyes is there. Like many personalities, I have read those articles, and every day in social media they put such a beautiful kind of articles, and they educate people, educate therapists. Fabulous.
Amazing, sir. Thank you so much for this, sir, because I think this is going to help a lot of people to understand pain better, because that is the ultimate goal for you also and for me also, that we have to make more and more people aware about it. And sir, also I want to know about your best paper about pain, which you will like others to read.
Okay, this is my experience. I think one of the paper, Adrian Lewis. Yesterday I was talking about you only.
Yes.
Adrian Lewis has done a very fantastic study using ultrasound. Okay, simple ultrasound what we use. The best part of ultrasound, that whole paper published in the South African journal Physiotherapy. He uses 3 groups of delivering the ultrasound. Normal one group he selects to deliver normal contemporary what we give clockwise kind of whatever that kind of ultrasound. Second group he gives that anti-clockwise kind of treatment. Third group nothing. So first 2 groups always there's communication exists between the therapist and the patient. In the third group nothing was there. So ultimate result came for the very good who uses anti-clockwise kind of a reinforcement of the patient. So they got more benefit because therapists are constantly talking, and all the ultrasound machine was detuned. Only power is on. That's it. Now imagine how the pain has reduced. You have to think.
Yes.
So that means for patient expecting you are giving something, communication the key factor for all these delivering what we do, this rituals of therapy. We call it theatrics of therapy, we call it as.
Right.
That works, not the ultrasound delivers the ultrasound and reduces the pain. No.
Yes.
So we call it a non-specific effects. It's a fascinating paper.
So guys, you should definitely read this paper what sir is suggested. I'm sure that you will be also fascinated by like how sir just explained about it. And about pain, we are going to talk more and more. Definitely, we are going to get more information from the sir, and maybe that is going to happen in the next episode of this particular podcast. And if you want to see more videos like this, don't forget to subscribe Physiotrendz and like and share this video with more and more physios. Sir, thank you so much for all the information. Really means a lot, sir. Thank you.
Thank you.